Traditional chest drains have three chambers: a collection chamber, a water seal, and a suction control. In other modules, you'll learn about technological advances that, in some cases, replace these chambers with mechanical valves. The collection chamber is closest to the patient. The patient tubing connects to the drain here, and fluid accumulates in this chamber. You'll want to monitor the fluid's appearance. Postoperatively, you'll see bloody drainage that becomes darker over the first 12 to 24 hours. Serosanguinous drainage is pink to straw-colored and may occur postoperatively. And fluid from a pleural effusion may be clear to cloudy and, in the case of infection, even pus-like. Here's more information about the collection chamber.
First collection chamber column is calibrated in small 1 ml increments up to 100 milliliters in brightly colored bold numbers, then in 2 ml increments up to 200 milliliters. Subsequent collection chamber columns are calibrated in 10 ml increments up to the maximum drain capacity of 2100 milliliters.
The water seal chamber is in the middle of the drain. It allows air to leave the chest and prevents air from going back into the chest through the tube. Think of it like a straw in a glass of chocolate milk. You can blow bubbles through it, but when you suck on the straw, you pull up fluid instead of air. Since air can only go one way, you could call this a one-way valve. You'll want to monitor this water seal chamber to see if air is bubbling through the fluid in the chamber. Here's how.
Continuous bubbling observed in the water seal will confirm a persistent air leak in either the patient's thoracic cavity or possible tube connections. Intermittent bubbling with gentle float ball oscillation will confirm the presence of an intermittent air leak. And no bubbling with minimal float ball oscillation at the bottom of the water seal indicates that no air leak is present. Bubbling from right to left in the air leak monitor must be present to confirm an active air leak.
If there's no bubbling and the chest tube is in the pleural space, you should check to see if the water level moves up and down with respirations, reflecting pressure changes in the pleural space. This is called tidling, and if present, tells you the system is functioning properly. When the lung is fully inflated, however, this motion may not be visible.
Changes in intrathoracic pressure can be determined by observing the level of the blue tint water and float ball in the calibrated water seal column.
The suction control chamber is the third chamber on the left side of a traditional drain. Here's more about how it works.
The volume and height of water in the suction control chamber is what safely controls the amount of suction pressure provided to the patient.
Remember, it's the level of water that determines the amount of negative pressure transmitted to the patient, not the setting on the vacuum regulator.